staying on the outbreak of cholera in the country, which the NCDC has now placed on high risk and declared a national emergency. Let's talk about this with the National President, Association of Medical Laboratory Scientists of Nigeria, and a public health expert, Dr. Kasmir Fine. Good to have you join us.
Good evening, viewers. My pleasure to be here.
So, I mean, as you look at the different response across several states, what do you make of our response so far? And then the NCDC has also now placed it on high risk. What do you also make of that?
I would want to start quickly by commending the leadership of the Nigerian Center for Disease Control and Prevention. Of course, their response to outbreak has always been very top-notch. And the new HEMSman there, Dr. Jide Idris, is doing quite well by providing direction and making regulations, which sits very well with the core mandate of the Nigerian Center for Disease Control. Having said that, I would also want to commend the health authorities in Lagos State. How I wish other states are up in arms and upbeat with the efforts to contain this particular outbreak. My worry about cholera is that we shouldn't be mesmerized the way we've become mesmerized lately by this outbreak. Recall that sometime November, December 2023, we had this outbreak ravage parts of Cross River, I think the Obobra area. It ravaged there, and I consider that the foci from where this infection had become, had become fulminant and spreading rapidly. You see, the worry is that in all that has been done so far and what NCDC is doing, we need to come up with a containment strategy and a preventive strategy that will help us exit the endemicity. It is not just describing it as very high and high risk. I think it is time for us to come with a roadmap of exiting the endemicity of cholera in Nigeria. Cholera
and Dr. Kasmir, apologies for jumping in, but I just want to ask you, because you've talked about containment strategy. One of the things that the Lagos State Commissioner said, Commissioner for Health, Professor Akin Abayomi, said, is that, people are not presenting themselves in hospital while the case is still mild. What sort of community-based response should be activated to ensure that some of these cases are detected at a very early stage?
Well, we've looked everywhere from what the commissioner has said, but I think we've looked so many places, but we have not looked everywhere. We must begin to look at how to engage constructively with the community in the area of public health education. The point is that cholera is a disease that the driver is poverty. And as cholera is attempting to become endemic in Nigeria, it will rightly also be said that poverty has become endemic. And when poverty becomes endemic, as is the case now, cost of living very high, people eat anything, people drink anything just to stay alive, and that, of course, would make them vulnerable to infectious diseases like cholera. And when one person picks it, cholera is very fulminant and spreads fast. So it's a droplet infection, but then it's able to spread very, very fast because if you are attending to somebody who is beginning to present with symptoms of cholera, the likelihood that you that is managing that individual will come down with the disease is quite high. And so most times at community level, this information is not available. Information about how to process fresh food before they are consumed, particularly fruits and vegetables, are not a common conversation. We have issues with water, sanitation, and hygiene across the 36 states and the Federal Capital Territory largely. And so we need to address that. The issue of open defecation, insofar we have open defecation rampant and prevalent in Nigeria, we will keep having issues of recurrent and very persistent
and these are some of the things that the Lagos State government has also mentioned in terms of environmental hygiene. We'll see, some of the, now there is an effort, at coordinated response across the country by the NCDC. We'll see how that plays out. Thank you so much for your time. and National President, Association of Medical Laboratory Sciences of Nigeria, and public health expert Dr. Kasme Fine.